Vital signs. Vital signs. Vital signs are important indicators of health states of the body. Vital signs defined as various determinations that provide basic body conditions of the patient. 4 main vital signs: temperature, pulse, respirations, blood pressure. Additional vital signs: degree of pain, scale 1 to 10, color of skin, size of pupils and reaction to light, level of consciousness, response to stimuli. They are usually the first sign of disease or abnormality in the patient. Healthcare workers. As a healthcare worker, it is your responsibility to measure and record the vital sign of a patient. However, it is not your responsibility to reveal this information to the patient. Physician's responsibility. Temperature. Temperature is the measurement of balance of heat lost and heat produced in the body. Can be measured: mouth, oral; rectum, rectal; armpit, axillary; ear, oral. Too high or too low can be a sign of disease or infection. Temperature. Most temperatures are measured in Fahrenheit scale. However, many healthcare facilities are now using Celsius scale. Temperature conversion. Fahrenheit to Celsius, subtract 32 from F temp, then multiply by 5/9 or 0.5556 C, 212 degrees Fahrenheit. 32 equals 180. 180 x 5/9 or 0.5556 equals 100 C. Temperature conversion. Celsius to Fahrenheit, multiply Celsius temp by 9/5 or 1.8 and then add 32. E. 37 degrees Celsius x 9/5 or 1.8 equals 66.6. 66.6 plus 32 equals 98.6 F. Temperature. Normal ranges vary: 97 to 100 degrees Fahrenheit, 98.6, 36.1 to 37.8 degrees Celsius, 37. Temps vary during the day and where you take them. Temperature. Oral, taken in the mouth with thermometer, 3 to 5 minutes. Rectal, taken in rectum, 3 to 5 minutes. Axillary, taken under the armpit, 10 minutes. Oral, special thermometer is placed in the ear and measures thermal infrared energy from blood vessels in the ear. Temperature indications. Hypothermia, low temp, below 95 F. Prolonged exposure to cold. Death occurs below 93 F. Fever, above 101 F, infection or injury. Hyperthermia, above 104 F. Gets above 106, convulsions/brain damage/death. Pulse. Pulse is the pressure of the blood felt against the artery wall as the heart contracts and relaxes, beats. What gets recorded? Rate. Rhythm. Volume. Pulse rate refers to the number of beats per minute. Rhythm refers to regularity of the beats. Volume refers to the strength. Pulse is usually taken over the radial artery. Pulse measurement. The pulse of a patient can be measured at various sites. Radial, inner aspect of wrist above the thumb. Brachial, inner aspect of elbow. Femoral, inner aspect of upper thigh. Popliteal, behind the knee. Dorsalis pedis, top of arch of foot. Pulse rates. Pulse rates vary by age, sex, body size and physical condition. Adults, 60-90 beats per minute BPM. Adult men, 60-70 BPM. Adult women, 65-85 BPM. Infants, 100 to 160 BPM. Bradycardia, pulse under 60 BPM. Tachycardia, pulse over 100 BPM except infants. Respirations. Respirations reflect the breathing rate of the patient. Also note the regularity, rhythm, character, type, deep, shallow. Respirations. Normal rate is 14 to 18 breaths per minute, sometimes 12 to 20. Children slightly faster, 16 to 25. Infants, 30 to 50. Words used to describe breathing are also used: labored, shallow, deep, difficulty. Breathing terminology. Dyspnea, difficult or labored apnea, absence of respiration. Tachypnea, rate above 25. Bradypnea, below 10. Orthopnea, very, very difficult in any other position other than sitting. Cheyne-Stokes, periods of dyspnea followed by apnea. Breathing terminology. Rales, bubbling or noisy sounds caused by mucus or fluid in lungs. Wheezing, difficulty in breathing along with high-pitched whistling during expiration. Cyanosis, a dusky, bluish discoloration of the skin, lips and/or nail beds as a result of decreased oxygen and increased carbon dioxide in blood. Measuring breathing. Best done with the patient unaware that you are doing it. Count respirations after performing pulse check. Continue holding wrist and count each inspiration/expiration as one. Blood pressure. Blood pressure is the force exerted by the blood against the artery walls when the heart contracts and relaxes. 2 readings are recorded: systolic, contraction; diastolic, relaxation. Measuring blood pressure. Instrument, sphygmomanometer. Normal systolic is 120 mm Hg, range from 100 to 140 mm Hg. Normal diastolic is 80 mm Hg, range from 60 to 90 mm Hg. Hypertension, BP to high. Hypotension, BP to low. Measuring blood pressure. Roll up patient sleeve to 5 above elbow. Position arm palm up and supported. Wrap deflated cuff 1-1.5 above elbow, center of bladder of cuff should be over brachial artery. Measuring blood pressure. Systolic pressure, tighten valve, pump up until pulse is no longer heard, slowly release pressure and record pressure when pulse is first heard. Diastolic pressure, continue slowly releasing valve and note when pulse disappears or when there is a significant change in sound.